Hi, if you're like me, you have children who are active in sports, which is a great thing because it has so many health benefits and social benefits, but we all know it's not without risk of injury. And even as a dentist, I was surprised to know that every year 2 million teeth come out as a result of trauma to sports injuries. Thankfully, about 200,000 teeth are saved because of protective devices like athletic sports guards. The problem with athletic sports guards is they're not all the same, and it's important to know which ones will protect you and which ones will cause harm. So we know if a child is injured in sports, it's very traumatic and stressful, both for the child and the adult. If it's a tooth injury, we can often repair what happened and make it look normal or close to normal for a couple $100 to a few $1,000s. But over the lifetime of that child, it ends up to be a major expense. So not only to protect us from the stress of an injury, but also for the expense, what my recommendation is the sports mouth guard. So a lot of sports require you to have them: football, lacrosse, field hockey, ice hockey. Other sports that cause a lot of contact that really do have a large number of dental injuries are also basketball and baseball, and you could use them from anything from those sports to bike riding, anything you want to protect your teeth. So what are the different kinds of mouth guards and what are they doing? The over-the-counter ones that you just buy that aren't fitted at all to the teeth, it's more just like a tray and you put it in, those mouth guards are the ones that actually can cause more harm than good, because during blunt trauma, it's focused on one area of tissue or teeth, and it can cause the injury to be worse in that area. So you are better off not buying those and not wearing one at all than having those in at the time of an injury. The next step up from that is what a lot of people can find, because they're in sports stores, they're inexpensive, and they're the boil and bite type where you heat it up and the athlete bites into it. Those can last a little while, but the problem with those becomes they can get chewed through and wear out quickly, and the athlete has to position their teeth together while they're wearing it in order to keep it in. So check those. If you're using those, you want to replace them pretty often and make sure that the child is wearing them. Sometimes they don't wear them because they're not as comfortable. The ones that work the very best are ones that are custom made either in your dental office or at a dental lab, because they're made from a model, an exact copy of people's teeth, and they're molded to fit the teeth and the tissues all around. They're comfortable to wear, and because they're custom made, in the event of an injury, it will give you the best protection there is. So I know it's a little more expensive to get the custom-made ones in a dental office. It takes time to do, but if your child is doing any of those sports, I would recommend you invest the time and money into it so that it saves trauma if there ever is an injury, and it can save expense long-term to the life of the child. Thanks for listening.